This is James. He's got a little bit of lower back pain today, and we found out that the problem is in the lower two vertebrae, L4 and L5. This area of the spine, the nerve comes out, it controls the muscles of your back, the butt, and it also goes right down into the leg. So if you've got a problem here, you could have local just back pain in the center of your spine. Often it spreads out like a little band, but it can also go into the butt and into the leg as well. If it's been there a long time and you've got some disc trouble, you might start to experience pain going down your leg, or numbness or tingling. One of the signs that it's a disc problem is that it's going to go past your knee. Pretty much any pain in the back is a good thing to get checked out, but it is a little bit more damage if you do have it past there. Okay. First adjustment I'm going to do is just in here, James. Can you take a deep breath in for me? And all the way out. Good. One more breath here. And out. Nice. One more breath here. And out. Good. Okay. Can I get you lying on your side, facing me this way? Bending up for me. Good. Deep breath in. And out. Nice. Other side. Very good. Cool. So from this angle you can see this is the L5 vertebra here, just above the belt line. And what we do, just bring the leg up to bring the spine into tension. Put my hand on the L5 vertebra. Twist over and good. On your back for me. James is also getting some headaches and migraines also as well. So it's really common that it's sometimes the case that when you're getting headaches or migraines, there's a problem with the upper cervical spine, the top of your neck. So what I'm looking for is an area in the neck that is where a muscle's gone into spasm or is really, really tight. And then usually when you push on it, it hurts a little bit more than other spots. Is that hurting that?
Yeah, that is.
Yeah. So this nerve that comes from here, it basically travels out from your neck into the upper cervical muscles, the upper neck muscles, and then it goes up into your brain. And if it's irritated, it can often either refer pain into your neck, or it can go up into your brain. Sometimes it's a trigger of migraines as well. So I'm just going to rotate you here. Take a breath in for me. And nice. A little bit lower too, huh? So the nerves from here go into your shoulder. Good. Nice. Come and have a seat for me. Beautiful. Very good. Have a stand up and walk around. How does that feel?
Feels much better.
Yeah, excellent. Cool. Another one saved.